Yeah, I've done that. Okay, now I'm fine. Thank you. I'm starting now. Okay. Ladies and gentlemen, good morning, and I am sorry for that little conversation with my colleagues sitting in the UAE. I am coming to you from India, where I am spending a week. This is our 6th webinar in the Obefit series. I must tell you that only last week, when we looked at our statistics, we reviewed and came to know that there are more than 54,000 individuals who are actively watching the Obefit program, which is a sister program of the Obefit, which has an audience of 10,000 odd participants separately. Nevertheless, welcome to our Obefit webinar, and this is the 6th series, and our topic is the metabolic syndrome, obesity, and the metabolic syndrome. Now, what is the metabolic syndrome, and why would we select the metabolic syndrome as a topic in our program? Simply because the starting point of the evaluation of a metabolic syndrome is truncal obesity or obesity. And what is the metabolic syndrome? Also known by the unique name of syndrome X. It is a combination of factors that include hypertension, high blood sugar, hyperlipidemia, truncal obesity, triglycerides, et al. It is most commonly seen in Asia, and there are more than 1 billion individuals who suffer from syndrome X. What are the outcomes of syndrome X? Now we know that the metabolic syndrome is a combination of factors: hypertension, diabetes, hypercholesteremia, and so on, and this predisposes you to high cardiac risk, a stroke, and even cancer. To tell you more about this is our esteemed head of department in the RAC hospitals, the head of department in endocrinology, Dr. Hala Hamdi. Now, Doc Hala has done her studies in medicine. She's a member of the Royal College of Physicians and has completed her advanced studies in endocrinology and diabetes. Her spectrum of activity includes diabetes during pregnancy, diabetes per se for adults and children, thyroid disorders, metabolic bone disease, adrenal disorders, polycystic ovarian syndrome, and so many other ailments. I leave you in the able hands of Dr. Hala, who will talk about the metabolic syndrome in relation to obesity and being overweight. Dr. Hala, thank you so much for agreeing to come on this session today.
Good morning, sir. You can hear me?
Yes, Doc. Absolutely fine. We can see the slides also.
Okay, thank you. Thank you very much. And I want to thank you for allowing me to address this important topic, the metabolic syndrome. We are all advising people to take care of their weight and to lose their weight. This is because of this important topic, which is the metabolic syndrome. Aim of this talk is to understand what is the metabolic syndrome, its risk factors, its effects, and how to manage it. Metabolic syndrome is not a disease. It is a group of risk factors that raises your risk of heart disease, other health problems as diabetes and stroke. We mean by the metabolic, the biochemical processes that involved in the body normal function, while risk factors are conditions or habits that increases your chance of developing a disease. As we say, smoking, for example, is a risk factor for lung cancer, and so on. So, as we see, metabolic syndrome, a combination, visceral obesity, cholesterol, high triglycerides, blood pressure, sugar, and so on. There are 3 or more factors to define the metabolic syndrome. We have 5 risk factors. If 3 are present, then this is the metabolic syndrome. As abdominal obesity, we mean by the abdominal obesity, the waist. For men, if it is more than 40 inches, for ladies, if it's more than 35 inches. The triglycerides, if it is more than 150 milligram per deciliter. The high density lipoprotein cholesterol, which we said it is the good cholesterol. So if it is low in men, less than 40 milligram, or in ladies, less than 50. The blood pressure, if it is more than 130/85, or the fasting glucose more than 100 milligram per deciliter. So we have to understand that there are numbers. We have to see these numbers, and then the risk factors are defined. So what is the etiology? What is the cause of the metabolic syndrome? We are concerned by the visceral adiposity, the visceral fat, and not the subcutaneous fat. And this visceral fat acts as an endocrine gland secreting many hormones and peptides, which leads to this problem. So metabolic syndrome is thought to be caused by the adipose tissue dysfunction and the insulin resistance. Both the adipose cell enlargement and infiltration of other cells as macrophages result in the release of the pro-inflammatory cytokines and promote this insulin resistance. Insulin resistance appears to be the primary mediator of the metabolic syndrome. The insulin promotes the glucose uptake. It helps the glucose to enter the cells, the muscle, the fat, the liver cells, and then influence lipolysis and production of glucose by the hepatocytes. Fat that is visceral or intra-abdominal correlates with the inflammation. As we said, subcutaneous fat doesn't include this. Abdominal fat is known to produce potentially harmful levels of cytokines as tumor necrosis factor, adiponectin. Adiponectin usually, it helps in improving the insulin sensitivity. If there are excess adipose tissue, adiponectin, it will not be secreted. Leptin. Leptin usually helps if people have leptin deficiency, then they will have polyphagia and obesity. But the strange thing that in insulin resistance, the leptin is very high. This is called leptin resistance. Also resistin. Resistin also acts and antagonize the insulin action and the plasminogen activator factor inhibitor. All these are secreted by this subcutaneous, the fats in the abdomen, the visceral fat. So insulin resistance is a condition in which the body cannot use the insulin properly. There are high insulin, but it cannot enter the cell. Insulin is a hormone which is secreted by the pancreas and helps to move the blood sugar into the cells where it is used for energy. Insulin resistance can lead to high blood sugar level, and it's closely linked to overweight and obesity. Because of that, when we calculate the insulin resistance, it is an equation between the insulin and the blood sugar. Contributing factors appear to include the following. All these can cause this metabolic syndrome, and the cause of it: the insulin resistance, the pancreatic beta cell dysfunction, the cellular dysfunction, suppression of the insulin receptor substrate 1 and 2, obesity, lipid toxicity, oxidative stress and glucose, chronic inflammation by these cytokines which are secreted, disrupted circadian rhythm and dietary effect, and gut imbalance. So metabolic syndrome, which sometimes called syndrome X or the insulin resistance, it is a serious health condition that puts people at a higher risk of other health problems. Numerous associated cardiovascular complications, particularly coronary heart disease, heart failure, aortic stenosis, ischemic strokes, and possibly venous thromboembolic disease. Cardiovascular diseases and diabetes coexist and are two leading causes of death. Emergent data also suggest an important correlation between metabolic syndrome and the risk of stroke. Metabolic syndrome will also be linked to neuropathy. Beyond the hyperglycemia, which may be caused, also there are inflammatory mediators which cause this neuropathy. The metabolic derangements which happen have been implicated in the development of the non-alcoholic fatty liver disease. The non-alcoholic fatty liver disease can lead to liver cirrhosis, which is we know these implications. In addition, metabolic syndrome has been implicated in several other diseases as obstructive sleep apnea. Obstructive sleep apnea, which leads to hypoxemia and later pulmonary hypertension. Breast cancer also has been linked to the metabolic syndrome, possibly through dysregulation of the plasminogen activator inhibitor factor. Additional studies have linked metabolic syndrome with cancers of the colon, gallbladder, kidney, and possibly prostate gland. Metabolic syndrome between pregnancies increases the risk of the recurrent preeclampsia. We see here the relation between the abdominal waist or the abdominal adiposity is associated with increased risk of cardiovascular events, with cardiovascular death, with the myocardial infarction. Even all-cause deaths are increased with increasing the waist circumference. So here, the risk factors for the metabolic syndrome: the high triglycerides, the low high-density lipoprotein, the abdominal adiposity, the blood glucose, if even it is in the pre-diabetic state, it is only the fasting more than 100, hypertension, the insulin resistance, the prothrombotic state, the oxidative stresses, the inflammation. All these lead to these associated diseases, neurological disorders as neuropathies, polycystic ovary syndrome, the cancers, the cardiovascular diseases, the type 2 diabetes, strokes, NASH, which is the non-alcoholic fatty liver diseases. So how can we manage this problem? Lifestyle changes and weight loss. These are considered the most important initial steps in treating metabolic syndrome. This is not easy. Lifestyle changes and weight loss needs cooperative and support from others. We need to exercise daily. We need to choose what we eat. Physical activity of at least 150 minutes per day or 75 minutes vigorously each week. This controlling of the cholesterol, controlling of your blood pressure, controlling of your sugar. If the weight loss are not by exercise and not by weight loss, then we add pharmacological agents. If it is still not controlled, then surgical intervention may be added. Also, we have to monitor the cholesterol if you need medicine. Your sugar, if it is not only controlled by the diet and the exercise, then medications have to be added. Evidence exists to support that the diet, exercise, and the pharmacological interventions may inhibit the progression of the metabolic syndrome and diabetes mellitus. Thank you.
Professor Kennedy.
Yeah, I am unmuted now.
Yeah, please.
I would like to thank Dr. Hala very much for her short and precise presentation. Dr. Hala, are you through? Do you have any more slides, or can we go straight into the question and answer session? Dr. Wilku?
Yes, sir. Dr.
Does-
Hala, if you want to present some more slides, you can surely do that. Or if you want, we can go to the question answer session.
Yeah, I can go to the question, Dr. Wick.
Okay, fine.
Ladies and gentlemen, ladies and gentlemen, it is my pleasure now to open this entire session, and we have a little extra time today to open this entire session to questions and answers, for which I will request my colleague, Dr. Wilku, to kindly take over. Dr. Wilku, sir.
Yes, so thank you, Professor. Thank you, Dr. Hala, for a wonderful presentation, precise, like Professor said, short and precise. So we'll be taking a few questions in the chat box also, and we have received many questions in the email also. First, just a sec. Yes, ma'am. One participant, Parampreet, is asking, individuals with thyroid disorders find difficult to lose weight. What can we do? I think Parampreet is also having thyroid problem. Dr. Hala.
Yeah, if the thyroid is well controlled by medicine, there will be no problem in losing the weight. We give the replacement therapy for this thyroid problem, then this is not the problem.
Okay. And I think answer has been given very clearly. Harshad is asking, my mother is pre-diabetic and has thyroid problem also. She is given metformin 500 twice a day. What would you suggest her to do as a protocol?
I cannot understand what protocol you mean.
Means for the weight loss and metabolic disorders, everything, because she is pre-diabetic. She is on metformin 500 twice a day, and she has thyroid problem also. So what is your suggestion for her?
Yeah, at first she has the thyroid to be controlled. It's monitored by the TSH. That means that her thyroid should be controlled first. She should check her lipid profile, okay, to see whether she is controlled or not. Because as we said, the metabolic syndrome, the lipids play an important role. Okay, and to see her thyroid, her sugar, if it is controlled or not. She is pre-diabetic, but she still have to follow by the HbA1c to see whether it is well controlled or she needs more medicine or better control on her food and exercise.
Yeah. Thank you, ma'am. Ms. Vidya is asking, how much does PCOS, this is a very frequent questions we come across, affect metabolism? How can we fix a metabolism with a patient who has a PCOS?
Yes, usually in PCOS, there is increase in the luteinizing hormone, and this is caused by the insulin, when the insulin is high. And this is like a viscous circle. The PCOS is a metabolic disease. And usually we have to also to check her sugar and her lipids. And there is incidence increase in the cardiovascular diseases and cardiovascular risk in patients with the polycystic ovary syndrome. So you have to check her lipids, her sugar, and maybe sometimes if it is needed, she should be started on the metformin.
Yeah, thank you, ma'am. Bharat Rathore is asking, people take hunger suppressing medicines. Is it good?
There are an FDA drugs which is approved for losing the weight. But this is indicated according to their BMI. And their action is to suppress, yes, the appetite. But it is not what we take from anywhere. It should be under the advice of the doctor, because it has some side effects also.
Yeah, thank you, ma'am. Alex is asking, this question is a very genuine question, because we come across many times people do this to control their sugar, control their weight also. Is fasting good to control blood sugar?
You mean intermittent fasting?
He's asking fasting.
Fasting for what? This is usually called intermittent.
People used to, generally what I understand with the question, people used to skip meals just because they wanted to lose weight and they wanted to control their sugar. I have personally seen many people during when we go to the corporates. So people are not eating anything, they are not following a pattern of intermittent fasting. They wanted to avoid eating so that their weight is less, their sugar is less.
Of course, if you, the idea of this intermittent fasting is to reduce your insulin. If any carbohydrates is stimulating the insulin to be increased. So if you are intermittent fasting, then your insulin becomes low. But the problem when you break your fast, what you will eat, still, it should be controlled by a balanced diet. If you eat again high carbs, then the insulin will be raised again, so you will do nothing. The idea is what you eat, when you eat, what you are eating to reduce your insulin in your body.
True, true. Moha is asking, is thyroid problem reversible, or does the patient have to take medicine lifelong?
See, there are some cases like thyrotoxicosis in Graves' disease. Some, about 60%, if they take the oral medicine for 1 or 2 years and we check for the thyroid receptor antibodies and they are disappeared, then we'll stop the medicine and follow. And usually there are sometimes relapse, but sometimes no. For the hypothyroid, it depends. Sometimes they are said after the delivery. There are postpartum thyroiditis delivery. Sometimes after 1 year, we can check the antibodies. If we can try to stop or reduce the medicine and see the response. So there are some cases, maybe we can.
Yeah, thank you, ma'am. Mr. Lamiz is asking very interesting question. This generally is being asked in UAE and Gulf countries where insurance is very prevalent. If obesity is so dangerous and harmful, why bariatric surgery is not covered under insurance for morbid obese people, since that will save money, more money in a long run? It's a good question.
Yeah, and this is a great problem because even for the medicine which can reduce the weight, it is also not covered by the insurance. In spite that now obesity is termed as a disease. It's not only because there are many problems with the obesity. So we are trying and giving many reports for them. Sometimes they approve, sometimes they don't.
Generally, they don't. Generally, they don't. Yeah,
Unfortunately.
that's the biggest issue. Harshad Singh asking, a person is diabetic and is on insulin. His BMI is 29.5. What dietary protocol and what metabolic management you will be suggesting?
Well, it depends. This insulin, he is type 1 or type 2. It is the type 1 or secondary failure. This insulin, he is taking the insulin. A secondary failure
Yeah.
was oral and then he shifted to insulin, or it was type 1 diabetes. In all cases, we teach the patient for the taking the insulin that he should calculate how much carbs he is taking so that he can calculate the insulin dose he is taking it.
Yeah. Ranjana is asking, can you please suggest some exercise for 55-year-old lady? She is doing regular walking, about 10,000 steps. She is having thyroid and cholesterol. Basically, the patient has a metabolic syndrome, and from her side, she is doing walking for 10,000 steps every day. What will be your suggestion to this patient,
Yeah,
this client?
the walking is very important. It would be a rapid walking. It is not only by the number of the steps, it is by the effort you get it. So when we say half an hour, it should be in rapid steps. This is the most important thing, not the number of the steps.
Yeah, the frequency and intensity of exercise,
The
that
intensity
matters.
is very important. It's most.
Yeah, that matters. Vidya is asking, most of metabolic syndrome risk factors don't have any symptoms. Yeah, true. Is it true or false? How can we understand? I will little elaborate with this, because many patients have, it's known that cholesterol creates a blockage. Most of the people used to know this. And they also know if your cholesterol is high, you are not going to get any immediate symptoms so that you can consult a doctor. What is the parameter they should be looking for, whether they have a metabolic syndrome or not? I think, Doc, you can club together with the family history, their lifestyle, everything, you can correlate with that.
There are no symptoms, and this is the problem, okay? And as we said, there are risk factors. So if the patient have an adiposity, if he has a family history of blood sugar, okay, then he should screen himself to know whether there is a problem or not. Many patients, when come to the clinic and I measure their waist and ask about the family history, and then we check how much the lipids is, and whether he needs treatment or not. You calculate his risk of getting the coronary diseases or the heart, and see if it is more than 6% in the 10 years risk, then we start even statin for him. This is the way. There is no symptoms. It is only you see that your adiposity and the family history, and then you should check by blood tests so that we can know. You measure your blood pressure. Even if your blood pressure is 135/90, you will have no symptoms. If your blood sugar is 110, you will have no symptoms. And this is the problem.
Yeah. I will just add to this because when we are doing the health screening for corporate and community camps also, most of the cases you find, especially like blood pressure and sugar, elevated glucose levels, they are found accidentally, they are diagnosed, whether the person is having it or not. So for that reason, what Dr. Hala was saying, I will add to that point. If you have a family history of blood pressure or heart problem or diabetes or high cholesterol, you should monitor yourself. You should go for a health checkup. And if you don't have any family history, even though if your age is above 35, you should be going for preventive health checkup at least twice, once in 2 years or once in 1 year, according to your age and your symptoms. That will give you information where you stand. And according to that, your doctor will help you to monitor this. One more question is Mohammed Adnan is asking, is obesity is the effect of metabolic disorder or metabolic disorder is an effect of obesity?
Well, as we said, the obesity, these fats secretes many cytokines and hormones that leads to the metabolic syndrome.
Yeah. So it's a vice versa situation, whether you have obesity, whether you have metabolic syndrome, both will be simultaneously come chasing each other. That's a problem. Mr. Umar is asking, how can we fix saggy skin after weight loss? This is interesting. He is looking for very fast, and he is looking for what next he has to do after weight loss.
Yeah, you see, after bariatric surgery, if there are much loss of weight, usually they do the operations for the skin, like tummy tuck and so on. But if you lose weight slowly, it will not happen.
That's the reason we suggest gradually lose your weight. Don't go for a crash dieting. Yeah. Mr. Mohammed Adnan is again having one question. Is there any diet which can streamline metabolic function? Like people say having 1 teaspoon of vinegar and 2 glasses of water morning will reduce cholesterol. Do you go?
No.
Yeah, well.
I cannot accept this. Yeah, there are some natural things which help. Yeah. Like the cinnamon, masalan, it is said that it reduces the blood sugar. Okay, so it is accepted, and there's some papers about it. Okay, there are some papers about the garlic that it reduces the cholesterol. But for the vinegar and water, I don't advise, because even the vinegar may hurt his stomach.
Yeah. Acetic acid is good, and as well as it works very badly if you are not taking it properly. Yeah. So that's true. Vidya is asking, how can we prevent childhood obesity? What are the complications arise due to childhood obesity?
The child obesity, this is the family role. And if I have a patient with metabolic syndrome, I always suggest that all the family eat healthy food. The problem that we give our children more chocolates as a reward for them. They should understand that these chocolates or sweets are not good. They should understand what is healthy food and to be adapted to it. It will not be a punish. When we tell an adult person to avoid sugars as if it is a punishment for him. No, this is not a punishment. This is a way of life. They should treat their children about it from the start, so that no more fat cells are increasing in their children.
Yeah, thanks, Doc.
Dr. Wilco, may I?
Yeah, yes, sir. Please.
A very interesting question by Vidya about preventing childhood obesity, and I thank Dr. Hala for her answer, in which she mentions that we should try and prevent children from eating commercial foods that include sweets and chocolates and so on and so forth. I absolutely agree with you, Dr. Hala. I absolutely agree with you. There are a few other factors also which, in my limited experience, I would like to point out. Now, the food that the child eats, I would prefer personally that it should not be of a commercial kind. And I'm talking now about hot dogs and Coca-Cola and things like that. Commercial foods should be avoided. Now, if you want to prevent obesity in a child, I would imagine that the first factor that you would look at is the family structure. Do the child's parents, for example, are they large built? Are they obese or whatever? Then you would like to ensure that the child has the right food in the right quantities. And you are talking about emphasizing a natural diet of fruit, vegetables, chicken, fish, in case the child is vegetarian, and certainly avoiding commercial foods. That is the emphasizing factor. We need to go for natural foods and avoid commercial foods. On the other hand, you do not want to restrict the child in eating good food simply because the child is growing and the child requires those additional calories for body growth and for cognitive development, and so on and so forth. And therefore, you bring in a second factor into managing childhood obesity, and that would be physical activity. Now, I would personally like to suggest two things. One, we must restrict our children's time on TV to not more than an hour or so a day. And we must restrict our children's time on electronic, on mobiles and other such things. And we absolutely must send our children out to play in the playing field where they run around with other children. It improves their metabolism, it improves their circulation, it burns their calories, it relaxes their mind, they sleep better. We must make it necessary for our children to spend at least 2 hours every day playing in a physical way. This is so important. And the third and final thought that I have over here is that parents must set an example. Now, it is perfectly okay to tell your child, go and play. It is perfectly okay to tell your child that they must eat the right food. But what example are you setting? So in case you would seriously like to manage the obesity of your child, and you must, then it is vitally important that you join your child in those physical activity periods and set a good example. Thank you so much, Dr. Hala. And Dr. Wilco, I hope you didn't mind my adding a few thoughts in that area. Thank you so much.
Absolutely no, sir. This is what a wellness guru teaches the community. Absolutely true. What you said is acceptable. So, but we have to follow. Every parent has to follow this. Thanks for sharing your concerns, Professor. There is one more question. There are two more questions. Mohammad Adnan is asking, what could be the root cause of metabolic disorder? So, so that if we understand, so we can work on it.
Okay, again, the gain of weight. This causes the adipose tissue to secrete some substances that aggravate the insulin resistance and causing this metabolic syndrome. So if we control our weight and take care of what we eat, this will not happen.
Yes, yes, Doc. True. Vidya is asking, is there, actually, I was also going to ask the same question. Is there any natural remedies or approach for a metabolic syndrome or obesity? Is there any test for that?
Test for what?
Test means like an examination investigation for a metabolic syndrome.
Yeah,
You have already mentioned about that,
yeah.
But again,
please. In
brief,
yeah, they are the blood tests plus the waist of the dimensions of your waist is an indication that you have this metabolic syndrome. Plus the blood test for the sugar, for the cholesterol, measuring your blood pressure, all these contribute and diagnose if you have metabolic syndrome or not.
Yes. In a nutshell, what I will suggest, go for a basic health checkup, the preventive health checkup, at least once in 2 years, if you are around 30, 35 years old. And if you have a family history, you should do it right now so that you come to know where you stand and what is the way forward about your to manage it. Next question, what I will be taking is, okay, that is a comment from Umar. Ma'am, I was about to ask the same question what Vidya has asked. What do you suggest as a guideline for managing your metabolic syndrome? What a person should do? In a nutshell, everything should be covered.
Okay. If he is diagnosed already as being diabetic, having a metabolic syndrome, he should follow his blood sugar, he should follow his cholesterol, and then how to manage it. We said about the food. As Ruba said, balanced diet, avoid sugars, simple sugars, more vegetables, take the fruits which are not in high sugar content, exercise at least 5 days, 30 minutes, vigorous walking, and monitor your thing after 3 months, what is going on. It is improving or not. if you need pharmacological interventions or not. Maybe you need medicines. So you have to follow. It will not disappear easily. It's a hard task.
Yes, ma'am. Yes, ma'am. Generally, we in lifestyle medicine, there is a statement generally used, let lifestyle die medicine. If you are using your proper lifestyle, that will work as a medicine for you to manage and to prevent any of the chronic ailments. I think questions are over. And Professor, over to you.
Thank you. Thank you so much, Dr. Wilku. But before that, thank you, Dr. Hala. Thank you so much. Now, I am indeed grateful for the tests that you suggested, and I'm indeed grateful for the advice you gave us on medication in order to manage metabolic syndrome. But as a practitioner of lifestyle medicine, I am deeply indebted to you, Dr. Hala. I am deeply indebted to you for emphasizing that lifestyle change, diet, exercise, sleep, not smoking, and all these factors play an important role. You are, and Dr. Wilku is absolutely right. Lifestyle is a strong support system for our colleagues in medicine. It enhances the body structure, the body capability, and it improves the efficacy of those medicines which our esteemed doctors prescribe. So I am deeply grateful to you for suggesting the natural method of lifestyle change, which should be an integral part of what we do every day. Thank you so much, Dr. Hala, for your enlightening talk on metabolic syndrome. I would like to thank our audience, not only for listening in, but for the excellent range of questions. Now, you know, our speaker presents their perception of what a subject is. And then during the question and answer session, which is made available by Dr. Wilku, we get a completely new perspective on what the client would like to know. And I would like to thank our audience very much for helping us with asking the right questions. Of course, I cannot, I would be remiss if I didn't thank the team behind the screen, in a manner of speaking. Dr. Wilku, Sadeh, Safraz in this instance, Libin from our IT department. Thank you all so much for coming, for spending a part of your holiday in this session. And now on your screen, ladies and gentlemen, we have our next webinar. This will be on the 5th of Feb. On the 5th of Feb, we will be talking about yoga and obesity. Now, and we have an amazing speaker for this program, a professor who teaches business studies, but who has spent an entire lifetime in doing yoga. So this will be an exciting program, Yoga for Obesity, and it is so simple and easy for us to do. And with that, friends, I look forward to seeing you all once more on the 5th of February, on Saturday, the 5th of February, 11 o'clock UAE time. Thank you and good day.
Thank you, Professor. Thank you, Dr. Hala, for a wonderful session. Thank you, everyone.